Hey everybody, welcome to our podcast. Today we have an amazing episode. We're going to be talking about holistic solutions and prevention for headache. And if you have been experiencing any kind of headache, we're going to talk about what are the types of headache, what are the location of the headache means. We're going to talk about the common triggers, what are the things they cause, and we're going to talk about a lot of solutions. So stay tuned until the end. Make sure that you get your pen and paper to take notes, and let's get started. Then, welcome to Be Healthy Podcast, the best way to discover practical tips and holistic health information from amazing wellness experts in holistic doctors, healers, and even real people with incredible health journey story to inspire you to become the best version of yourself. Hi, I'm Anna Marino. I'm a self-healing specialist, a physical therapist, a best-selling book author, and a public speaker. I heal myself before, and I know you have the power to heal yourself too. And today we have a fantastic guest. We will be talking to Dr. Hans VanHeule. He is a chiropractor since 1992. He became certified in SOT, what stands for Sacral Occipital Technique. It's an amazing technique. Since 1996, he has been a table instructor at many seminars and also a teacher at elective classes for SOT and as adjunct professor. He uses SOT, MRT and craniopathy in combination with blood work and nutrition in a chiropractor functional medicine office to help his patients. He came from a chiropractor family where both of his father and his brother are graduated from Palmer College. That's so cool that you actually come from family of chiropractor. Dr. Hans, thank you so much for joining us today.
Thank you, Anna, for having me on here.
Yes, wonderful. So excited to talk about more about headache. Then let's kind of get started. Then share with us a bit more of maybe let's start with what's the difference between headache and migraine.
Well, with the migraine, most people know it as having the prodromes, where you have the vision changes, you have the hearing changes. Migraines, you just can't stand noises or anything like that. You just want to be in a dark room and curl up in a little ball and leave me alone and let it go away. And there are many causes for that. I don't know if they're, all understood really why this is happening. Whereas a headache is more of you have tension headaches, you have cluster headaches, or other kinds as well. But the way we look at it in chiropractic is also where the headache originates can actually determine also where some of the causes lie. For example, if you have a headache, right at the base of the occiput here, usually that is becoming coming from a problem with the pelvis, because all the muscles along the whole back, along the spine, are really tight, and it pulls right up in here. So that can be causing spinal, a headache right there. Headaches behind the eyes oftentimes are associated with liver toxicity. So then you have to start looking at nutrition. Okay, what is going on with this person? Different things like that. And you have to look at history. Frontal headaches could be sinus, it could be also stress. And, sinus could be also mold, different things like that. Pollen nowadays also. Um, Headaches like right here, at the temple or a little bit more in the head. Yeah, it could be other things as well. It could be stress induced. So we have to look at what is the lifestyle. But stress is not just lifestyle, it is also what is going on with, nutrition. How are you stressing your body? Not just food wise, but it also taking in different things. Now, the easiest cause of stress is dehydration.
Mm,
People don't drink enough water. Okay. Rule of thumb, there's no really good
mhm.
science that says you have to have this much water, but a rule of thumb that seems to be working for most people is just having like half your body weight in ounces of water. So you weigh 120 pounds, 60 ounces of water seems to be, very good for a lot of people. Okay. And being dehydrated can cause all kinds of other issues. It just slows down all the circulation in your body too. We need water. Too much water, obviously, is not good, but you drown then, and you can actually dilute your
Urine.
electrolytes quite a bit. There's actually been cases of that.
Mm-hmm.
Students binge drinking water, and for like hazing experiments, things like that at fraternities and so on, and kids die. So we need water, and everything is in moderation. That's really what it comes down to.
Absolutely. Oh, you
Yeah.
made such good points there. Let's kind of pause there and just kind of organize it. Like, okay, then let's review. Then we talk about the difference between the headache and the migraine. That's
Hmm.
really important for people to understand. Today, we're going to be focused on headache, and maybe we do another episode for migraine because that's a whole
Oh, it's
extra
a whole other ball of
topic
wax. Yeah.
on. And there are a lot of things that we can do for headache that probably will help people with migraine. If you have been experiencing migraine, is still listening because you're probably going to get a lot of tips from us today. And I
Mhm.
love what you're saying there about the location. The location can give you so much information. I totally agree. As a physical therapist, I also look at the connection. We're going to be talking more about posture in a minute, but there is that connection of like it can be from the sacrum. Like for me, also, I would add, agree with everything that you say, and I would add a lot of patients that come to me with eye pain, like migraine behind the eyes, sometimes can be visual. I had patients before
Sure.
that like their glasses or they needed to start wearing glasses or they feel the headache after being the computer for a long time and they
There you
just
go. Yeah.
eyes is straining or the screen's too small. Like some people need a bigger screen. The
Mhm.
location behind the eyes can be part of that. Um, and there is some blood pressure component that sometimes can cause of that behind the neck headache as well. The people need to kind of be aware of those. But the side, like if you have one side more than the other, sometimes it can be something originated from the neck. Like a lot of times people come like, oh, yeah, I have very
Could also be
restricted
your
the
jaw, your teeth not
jaw
fitting right.
as well. Then I think having when you're working with a professional like me or Dr. Hans is making sure that you also share the other symptoms because a lot of times it when we put it everything together, it's like, oh yeah, it makes so much sense. Then we can find the cause. And then when we find the cause, no matter what it is, it's so much easier to address when we know that.
Yeah, what you say about, looking for the cause is very important. People don't have headaches because they have an aspirin deficiency. There is a cause behind it. Now, so one of the specialties that I do is craniopathy. It's working on the cranial on the skull. We have 22 bones in the skull, and all these bones are actually slightly movable. It's
Mm-hmm.
more, it's not like a joint that they go open and close, but there is actually emotion in there. And people that, for example, that have throbbing headaches, it's usually because blood comes up into the skull and the skull has nowhere to go. So it presses down on brain tissue, does not have any pain receptors, but on other tissues around the brain that causes pain. So one of the things is we loosen up the bones in the skull very gently. This is not hard adjustments or anything like that. You can see it in an infant, you have all the sutures and so on. They don't fuse. And a lot of these sutures, they don't fuse completely. And that allows for expansion and contraction, allowing blood flow coming in, allowing cerebral spinal fluid coming in and out, and also going with inhalation. So you have to look at the rhythm, okay, of the throbbing. Also, is there throbbing in the first place? So there's a lot of different causes and a lot of little moving parts that you have to look for. So, the screens, being on the computer way too much, not having enough light on your computers is a big thing. Big, a lot of strain on the eyes. That
Mm-hmm.
is more of an eye strain. But if it's behind the eyes, oftentimes it is a liver toxicity. Okay.
Exactly.
Blood pressure also, like you were saying, can be a big component to that. But blood pressure is really more regulated by the adrenal glands
Mhm.
than not, and not your heart. So many people get that confused. So you have to look at, again, are you dehydrated? Because the adrenal glands go together with the kidneys itself. So you have
Mhm.
to look at that whole aspect, coming together there again. Yeah.
Yeah, water is so important. I'm like, listen about the water, like keep the water, I'm keeping my tea drinking. If you listen, you make sure that you get your water now.
Well,
Yeah,
I got my
even
water
a
right here too.
reminder.
I
It's
like to add a little bit of lemon in it just for flavor.
There
But
we go. Yes,
yeah.
fantastic. All right, perfect. And let's talk about the types of headaches. So you kind of started talking there, then let's kind of like expand a little bit more. What are the types of headaches?
Okay. Well, the one that we see the most often in a chiropractic practice is really the one right at the occiput, at the base of the skull. Okay. And you have to look, like I say, all these bones move when we breathe in and breathe out. And they move together with the sacrum, which is our tailbone. It moves in and out as well as we're breathing in and out. And they kind of make a pumping system on the top and on the bottom, allowing cerebral spinal fluid to flow up and down. Now, if your sacrum is not aligned the way it's supposed to be, it locks up the whole pelvis. Okay, or the pelvis can lock up the sacrum. Now, half your pump is suddenly not moving anymore. Okay, you can have other issues as well. The pelvis is off. It causes muscle tension more on one side of the skull than the other. So it locks down the occipital motion as well. So it can't have the functioning there either. So with chiropractic, we can do this. We can get the pelvis back in place. We can get this back where it needs to be. We can align the vertebrae all between the sacrum and the occiput. Okay, and that is one of the hugest things that we can that we can do. Pelvic misalignments are like one of the major things that people come in, for to a chiropractor, and it can happen very easily. You sleep wrong, you sleep crooked, you miss a little step, like an inch step and that you didn't see, and suddenly you're like, oh, you hurt yourself. Little things like that, carrying a bag on one shoulder more than the other. It all pulls the body sideways. Think of your house, of your body as a house. Your foundation is your pelvis. If your foundation's crooked, everything above it is going to be crooked as well. Your shoulders are crooked. All these muscles go into the occiput, into the jaw, into the maxillary bone, base of the skull as well. So if your pelvis is crooked, everything above it is crooked as well. So that's going to be pulling a whole bunch. You also have to look at even further down, and you can have sometimes, your footers of the house, and
Mhm,
that can be your knee, your hips, your knees, your ankles.
mhm,
Uh, some people have an anatomical short leg, but it's not very often actually that we find that. But because of the way the pelvis works, when we walk, it turns back and forth and it gets stuck on one side more than the other. It pulls the pelvis up on one side. That creates a short leg on one side. So you're standing crooked. So everything is going to be going crooked as well above it. And you can adjust here as much as you want to, unless you address the bottom, you're not going to bring your whole foundation back up. It's like in a
mhm.
house, foundation's crooked, the doors don't open right, or they stay, or they open by themselves. You get cracks on the drywall, bats in the belfry. Who knows?
Yeah.
You can get, and can be causing you headaches right there. So that is one of the things, the tension headache right back in here. Okay. Looking at the frontal one could be sinuses. In the mold loves hot, humid climates. Can we say Charlotte here? We have a lot of it, and it's not really the mold that we find out in nature. Our body can handle that. If we have a good immune system, we can handle that kind of a mold. It's the synthetic mold I'm talking about. I just call it synthetic. It's like the mold that is from a dripping pipe getting onto the drywall inside your walls, and it comes through the walls, and that's what we're breathing in and day out in our air conditioning systems. So that can cause a lot of issues. So you have to get rid of the mold before you really can get rid of the headache.
Mm.
And there are certain ways that we can do that. We have certain protocols that we can get rid of mold fairly easily, actually. It doesn't have to take 6 months. Really, in a week, 2 weeks max, we can get rid of a lot of mold in your body. But you have to make sure it's out of the house as well. Otherwise, you just walk back into your house and you get reinfested. So, there's different ways that, people can look for that, you know.
Mhm.
Um, The other one, headache behind the eyes, oftentimes is associated with a liver toxicity. Okay, and it just causes strain on parts of the brain. There's a lot of proprioceptions in that part of the brain that measures kind of what's going on in the body, parasympathetic, sympathetic nervous system, all of that right there. And if we have toxic liver, well, all those chemicals are going through in the gut are going through the blood into the brain, causing stresses right there, causing brain inflammation. Then you can actually look also at leaky gut issues,
Mm.
causing the same kind of things because now suddenly we're looking at leaky gut um, things going on. I don't want to get into the whole nutrition aspect of it, but we do have to talk about nutrition, I
Yeah,
guess, in a
yeah.
way.
Let's save that for the next topic. No, we don't.
Okay, next topic, we'll go there in
That's
a
a big
moment.
one to talk about. It. That's very important.
Yes. And then you have the same one, here with the parietal bones are on the side, here in your temples.
Mhm.
And that often is also because these bones are not moving, whether it is from a pelvic misalignment or just stress. High blood pressure, like you were saying earlier, can cause all kinds of issues there. The pumping, you have to look at, we can open up these bones very gently. This is not hard. The way I look at it, on the way that we adjust people, or is you can grab someone by the arm and yank them along and pull them along, and they resist the whole time. Or you can take them by the elbow and lead the body to where it needs to be, and the body will go living willingly and want to stay there as well. So a soft approach is often more beneficial than a hard approach. Okay,
Absolutely, especially on the
so
cranial.
pardon?
Especially on the cranial.
Oh, on the crane. Yes,
Like
you don't want to do
someone,
anything on it.
yeah, I think this is I want to do a full disclaimer here because I think this is really important for the listeners to know. If you have someone doing cranial work on you, first make sure the person has a lot of experience. Dr. Hans has years of experience, very knowledgeable. Then you want to make
Mhm.
sure that someone really knows what they do and keep their hands soft. I
Yeah.
actually personally had the experience before where someone was doing some cranial work and I was sore for like 2 days. And
Hmm.
that's not normal. Then I want to make sure the listeners, if you have someone working, I highly recommend the cranial work. It helps a lot. And I also wanted to differentiate the two techniques, at least that I'm aware, you correct me if there is more, but I know that we have the cranial sacral technique that's from, what's the name of the school?
Dr. Upledger.
A pleasure.
Yep.
And that is the other craniosacral, that's the school that you teaches. Then the craniosacral from a pleasure is a much lighter approach. And for someone that had received both, they're both wonderful.
Hmm.
But the pleasure approach, I personally didn't feel like it was moving the bone. It was moving the tissue, the fascia,
Hmm.
but I didn't feel the bone. Like when I was working with you, I really feel that difference of like, okay, the bone structure, the joint structure was really getting that benefit. And personally, that's what I was looking for when I met you. And I was like, oh, wow, this is very different than, correct me if I'm wrong, but that was my personal experience with the cranial.
I have, talking about Upledger, you have Dr. Upledger, Dr. Sutherland. He was like really the originator of craniopathy, and he was actually a DO and very good doctor of osteopathy.
Mhm.
Um, I have nothing against Upledger technique. It is a good technique, but
Fantastic.
it's the problem is, some people go for a weekend seminar. A little knowledge can be very dangerous. Okay, but I've had well-trained upledger people work on me as well, and very good results, and I
Mhm.
liked it. But
Mhm.
we have a little bit different um, philosophy about it. They work, yes, very gentle, but they're working more on an energetic level.
Mhm.
Okay, whereas I am more on the energetic level, but also a little bit more structure, moving it very gently. Okay,
Mhm.
and also we go in intraoral. I don't know if Upledger does that at all, but I
Hey,
look at the maxilla, the palate, that can all have a difference as well. You have to look at the TMJ because that, if your jaw is crooked, every time you're biting, your teeth hit differently, and you're creating more stress on one side than the other. So that's not a good thing. So,
Yeah.
but no, it's, craniopathy is a very good and valid thing, but it has to be done by someone that has experience with it. I've been doing this for now, 30 years. I
Yeah.
still learn,
Absolutely.
always, learning never stops.
And we all human, I don't want to blame the person, but I do want to put that disclosure because the brain is a
Absolutely.
very sensitive area, and we do need to be like aware when we
Hmm.
work in that, and we're not making more damage than helping. And like you say, I think like the apleisure approach and the craniopathy approach, they're a fantastic approach. They have different reasons and different benefits. It's just
Hmm.
for the person that's looking for the help, being clear of, yes, they are different, because I heard some people before, oh, but I done craniosacral. No, 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 this is a different technique, and vice versa, right? It's like knowing that first of all they are different and they have different benefits. Then with the difference, depending what you're looking for, you may find one technique better than the other for your specific case, but they're both fantastic technique. Then
Yeah.
just not pain. You don't want your brain get sore afterwards. That's the only thing that's not good.
Yeah. Cranial work has to be gentle, and it's like in all different things. You have different kinds of screwdrivers. You have a flat screwdriver and a Phillips screwdriver. They're both screwdrivers, but they work on different things.
Exactly.
So, and in the way is kind of like osteopathy is the same way. You
Mhm.
have SOT osteopathy, you have or SOT craniopathy, as osteopathic craniopathy, and you have upledger. So there's three
Oh,
different
that's right.
approaches.
It's the osteopathic too. That's the three different
Yes.
school of thoughts, and they're all fantastic. They're just a
Hmm.
bit different from each
And
other.
they have different applications at different times.
Exactly.
So yeah, you
Right.
can't use the same thing for everything. And
Right.
that's where,
I love that. I always joke with my patients, like you can't use a hammer for everything. We
no,
need to know, right? Sometimes you
especially
need to
not on the head.
definitely not a head, but sometimes you need a screwdriver. Sometimes you need a hammer. Sometimes you need different tools, and
Yeah,
it's so helpful when we have a toolbox.
yeah.
And
And
that's
that's what you need to do. And yeah, you have to keep learning. There are other approaches out there. And sometimes you learn in my experience, I've gone to a seminar and it's like, oh, okay, didn't really learn very much except this one thing. And
Mhm.
sure enough, next Monday that you'll find a
That's
patient that one thing was necessary. So yeah, you have to keep learning. And everyone is different.
Mhm.
No two patients come in with the exact same problems. It doesn't exist. And that is the difference, really, I think, between alternative healing and, the traditional medical healing. I know we're getting off topic here, but, the traditional medical healing is like, okay, you have a disease. We have we'll put you in that box and we have a pill for that box. But everyone reacts differently.
Mhm.
Going back to aspirin, how come some people can tolerate aspirin, others can't. Some people do better with Tylenol, some people do better with Advil. It's different chemistry. You can't treat them all the same. So we have to look at different things.
Mhm.
And in traditional medicine, it's like if the patient's not getting better, hey, maybe it's the patient's fault, because they're not following our recommended healing protocol. Whereas with chiropractic, we look for what is going on, what is the cause really deep down, and how can we best approach it for this patient?
Mhm.
That is the important part. Can they handle this, or do we have to go for a different direction here? And that is so important. And that is really where you have to become a detective.
Yes.
And you have to take your time. You can't do something like that in 10 minutes with a patient.
Mhm.
It takes longer. You have to really dig down and you have to look at all aspects.
Yeah.
If they're hurting, a lot of problems here, well, let's look at posture. Are they always on their phone with their head down? And a lot of young kids are having that problem now, and they're called, and it's specific to young children because they're getting more and more neck pains. Okay. Or are they sitting crooked on their chair all the time? And that could be causing a stress in there too. Okay.
Mhm.
So you have to look at what the heck is going on. And,
Yeah.
and you have to ask, you look at their body and you have to ask questions. What are you doing that is maybe causing this? And how can we alleviate this? Okay.
Mhm.
They're not doing it on purpose. They just don't, they don't realize what they're doing is contributing to certain things at times. Okay. And it
Exactly.
could be a nutrition deficiency. We'll talk about that later, maybe.
Yeah. And let's talk about posture, because I think that's a big topic. That's a lot of what I see in my office as a physical therapist as
Mhm.
well. And then we can jump to food afterwards.
Okay.
Then for posture, like one thing I love what you're saying there is the idea of sometimes we're not even aware of the posture that we have. And I always tell my patients the first thing first is always body awareness, because the more we
Mhm.
get aware of our body, the more we can actually correct our posture and realize, oh, I'm sitting on the computer with my neck like this. No wonder it's hurting.
Mhm.
Right? It's like when we start kind of like creating the awareness to where you are in space. So I'm sitting having dinner and I'm kind of eating like this. And you're starting putting that habit every single day you're doing something the same way because we do things unconscious a lot of times. And you keep repeating the posture and you keep putting the same amount of tension on those muscles, and that can be a big cause of headache. Then
Mhm.
I think things for people to consider, they I feel like for my patients are very common. You can add yours as well, but I think computer is a big one of that. That you wanted to make sure that when you are sitting on the computer, your neck is as supported as possible, but at least the back support is really important. If you can have a neck support and head support, I think it's even better. Some people can afford that chair or they don't have that chair, but you wanted to make sure that your back is supported and you want to make sure that your head is in alignment with your
Mhm.
neck. I see a lot of patients, they kind of like putting the neck all the way forward, and that
Yep.
put so much strain on the neck, on the jaw, on the head. The other thing that's a very simple tip that people can do it is the phone. Bring the phone up. Like the
Mhm.
lower you go, the more
Yep.
head tension you create. Then it's very simple. If you're sitting on the sofa on the couch and you're just gonna be on your phone for a while, you can put a pillow underneath your elbows, and that's gonna raise up. That you not be need to hold the phone. And if you are on the street or if you're just like looking at the phone throughout your day, remember to bring the phone up a little bit more. And just that can make a huge difference on the alignment of the head. And that takes a lot of the pressure from the neck and head as well. Then those couple tips I usually give it to my patients when they have headache. And just everybody needs that anyways, but especially if you have a headache, because the more forward the head goes, the heavier it gets.
Mhm.
So we wanted to
So,
get that support.
it's basic ergonomics. That is a big
Exactly.
thing. When you sit in a chair, push your butt back in the chair and then sit up. At the computer, have your screen, like you say, you have to have the head up, but you have to have your screen up higher as well. You
Mm-hmm.
know, look who's talking here. I'm looking down at my screen right now. So maybe not the best example. But what you were saying also, having the head forward like that, number one is you're straightening up the cervical curve. And the neck is supposed to have a curve because it's kind of like a shock absorber. The head is an 18-pound bowling ball sitting up here, and it could have to bounce a little bit on the neck. So if you have a very straight neck, the discs are being compressed. So that can cause problems because all the nerves come out between the vertebrae going down to the arms, okay, and your fingers and everything like that. A lot of people get numbness in their fingertips is because this is all compressed. Another aspect is that if you have your head forward like that, you can't breathe very good. Okay.
Yes.
So you open your mouth more and you bring your chin backwards more. Okay. So to help open up your airway. Now, what is going to happen more with this is later on, these people are being, I've seen some studies, it's not definitive yet, but it seems they have more of a possibility of getting sleep apnea later in life. So that can be a problem as well. So what you do now, especially as a young person, is going to have an effect to you later on in life. Okay. So you have to
And
look at that.
oh my
Yeah.
gosh, it made such an important point. Oxygenation for the brain,
Oh, yeah.
right? It's so important. Like when we think about posture, especially posture, like the more you are hunching forward, the more
Mhm.
you have closure on this area, the less oxygen it goes to your brain. And that can be a big cause of headache for a lot
Yeah.
of people.
And going with that is if you're, looking at your phone or like this all the time, your rib cage can't expand.
Exactly. And then you don't
Okay,
get enough
so if
oxygen.
your rib cage can't expand, you're not getting any oxygen in. And
Mhm.
also the rib cage helps with lymphatic drainage throughout the whole upper body as well. So you're looking at it's a cascade effect. We have to find the first domino and try and set that first domino straight before we really can start doing other ones as well. And it's a lifelong thing. It doesn't happen just in one trip. Okay.
Yeah, it's cumulative.
Where
That's
was I going with this? I had thought of something else and it just whoop, went out of my brain, but I'll think of it later with, the expansion of the rib cage. Again, oh, well, here it goes. If your pelvis is crooked, remember we talked about all the muscles along the spine going up? Well,
yeah.
if you're crooked, you have more tension on one side than the other side. That rib cage on the high tension side is not going to be able to expand as much as the other side. So again, you're only getting maybe less oxygen really getting into your body. So we have to learn how to breathe. We have to be able to take deep breaths in, okay, and
Mhm.
get good oxygen. Go outside, and take some deep breaths in,
Yes, we can do a
The,
whole
the,
podcast in breath. Breath is so important. Many times I spend a whole session with a patient just teaching them how to take a deeper breath because the majority of the people out there, they don't even know how to take a deep breath. Like,
Mhm.
I see a lot of people doing like abdominal breath, what's fantastic, that's good. But the abdominal breath is supposed to be all directions, not just forward. We want
Yeah.
all directions abdominal. We want the rib cage moving. You don't want a superficial. You don't want the breath going into the neck. That there's so much we can talk about breath. It's so important. And again, goes together. If you don't have a good oxygenation, don't have a good lung expansion, rib mobility, it will affect the capacity of how much breath you take. It's a whole nother episode for another day, but it affects fatigue, it can cause headaches, and it
Yeah.
does affect everything else together. Then and that's what I love about the approach that both of us have. It's the body. We can't just say, oh, it's headache. Okay, it's just on the head. No, no, no. It can be coming from so many places, like you say. Like sometimes it comes from the ankle, and you adjust the ankle and you retrain the ankle, and then boom, everything feels
Mhm.
better.
One of the things I tell my patients is a specialist knows more and more about less and less. you know, and yes, we need specialists, but at the same time, we need some doctors that can look at the overall picture
Yeah.
of what is going on. And it's if you start getting all the puzzle pieces together, you can really work it. Otherwise, you can get it going together. Otherwise, if you just look at one piece, it's like, okay, I don't know where this is going, and it might not fit in the puzzle right there,
Yeah.
right there. Then it might later on that you have to look at more specific structures,
Mhm.
but you have to have an overall picture of the patient's health first. And that
Yes.
is so darn important. And that's where chiropractic comes in there, nutrition comes in there, physical therapy comes in there, acupuncture comes in there, a whole bunch of different modalities. Massage therapy comes in there,
Mhm.
and people need one of these modalities. Maybe not all the time, but at certain times in their life and in their healing cycle, they need one modality more than the other. And then maybe it might come back to something else, and then maybe go back. So it goes back and forth. So you know, do you go to the same, do we need care all the time? Yes, we do. Because in a way, living is bad for our health. We start dying as soon as we're born. Okay. And with everything going on around us, our polluted foods, our polluted air, it all has the toll on our body. So we have to take care of ourselves more. People, I've talked with my father about this. Like I say, he graduated, 60 years ago. He's still alive. He's 96. He doesn't practice anymore, but and he says, "Oh, well, one, two adjustments, and a person was well." Nowadays, that's not the case anymore because people are weaker. We're sicker as a population in a whole, and humanity doesn't. We don't heal as fast as we used to. And
Mhm.
that is a problem. And that's where we have to look at, okay, what is that person missing that we can help heal faster, okay, or help heal more complete, instead of just one adjustment and, see you when it starts hurting or, when you're falling apart again. No, it's regular, it's maintenance.
Yeah.
It's like we change the oil on our car, every 3 months, not because we have to change it, but we don't want to have to change it because the engine blow.
You break
Okay.
it.
So that's why we did take care of ourselves. It's
Prevent.
preemptive, supportive care.
Yeah, it's
That's what
preventive.
we have to do.
Yeah. And I think it's important. That's why I love the idea of self-healing because yes, we do need a team. Yes, sometimes we do need to do maintenance. And the more you have the body awareness, the more you know when you need the maintenance. And the
Hmm.
more you have the body awareness and the more you have tools to work on yourself, the more you can do it. Then we can do a lot of things for ourselves. And when we do a lot of things for ourselves, then we don't need as much of the extra support. We sure need once in a while a little tune up, that's always welcome. But I
Hmm.
think the empowerment also needs to go back to, okay, it's my body. How am I treating my body?
Hmm.
And I think that's a missed component for a lot of people out there. It's like, am I doing this? Am I helping self-healing? Am I helping my body to heal faster? Or am I treating myself not very nicely, not feeding the right food, not exercising properly, not moving? Movement is so important for healing.
Hmm.
And once we start getting more of those better habits, then we are igniting the self-healing component as well. And that's like so important.
Yeah. At one point, I had a drill sergeant as a patient, and he always wore this T-shirt. Oh, pain is weakness leaving the body. I'm like, no. Pain is the body's way of saying something is wrong. Stop what you're doing and fix this first.
Mm-hmm.
So, it is an education thing as well. Which you say exercise is very important, but you can over exercise.
Yeah.
Some of the latest research that I've seen really suggests 20 minutes 3 times a week is pretty much it. And it doesn't have to be like until you're falling down. It has to be until you're kind of winded a little bit, okay? And, like a good walk for some people, a good walk with, 1 pound weights in your arms and you're swinging those back and forth, that's enough exercise for those people. But you have to do it on a regular basis. A younger person might need a little bit more as a jog and so on. But jogging and running is all very good, but it's a lot of pressure on your knees and hips and ankles. Okay. And then again, you look at like marathon runners, it takes a huge a toll on your body. It is just too much.
Mm.
Professional athletes, we see it all the time. They're training and training and training. They're fantastic specimens of health for a while, and then they fall apart, later on in life.
Yeah.
So, everything has a
Moderation.
toll. Everything has to be in moderation. And that's what we don't understand, seems to understand anymore in our society. We
Mhm.
all want it now, and we all want a whole bunch of it right now, you know?
Yeah.
So,
I call the microwave mentality. It's taking
the-
1 minute. It's too long. Why it's taking so long?
well, and the other things you don't want a microwave for is because it actually changes the protein structures of food itself.
Mm-hmm.
Don't put your food in a microwave. Okay, so it changes the molecular structure of a food. They used to, when you needed a blood transfusion at a hospital, they used to take blood that they have frozen, and they put it in a microwave to thaw it out, and then they would give it to the patient. They found that some patients had severe reactions to it, and later on through research, they found out that the blood structure or the chemical composition really of the blood was changed in the microwave. So now they always thaw out the blood through hot baths, in hot water and so on.
Oh,
So, it's not a good thing. Microwave heats, it just causes all kinds of vibration in the molecules. Not a good
interesting.
thing. Okay, so we want to stay away from electronics as much as possible as well. Don't keep your phone next to your bed. People have headaches and, just from being on the computer. Maybe it's not just the eye strain, it's from maybe
Electromagnetic.
electromagnetic fields too close to your head.
Yeah.
At night, you're having a clock radio right next to your head. Not a good thing always. So
Mm,
you might want to move that. Okay.
yeah.
So, it's hard to get away from electromagnetics, but I have had patients that have come in with these kind of issues, and you have to change their lifestyle. We're going back to lifestyle again. What is going on with them?
Yeah.
So,
And we
And then
had a
that's a whole other
great
discussion. EMF, you've had podcasts on
Yeah,
that.
we had a great podcast episode. If you guys are listening this and you want to learn more about the electromagnetic field and how it affects you, what can you do to prevent, make sure that you listen to that podcast episode because it was really good. I want to just wrap it up with the posture. I want to add one more piece and we're going to move it to the food tips.
Okay.
Then one thing I see a lot with patients that with headaches, especially, is when they keep saying like my body keep getting out of alignment and I keep adjusting and I keep adjusting. And not your patients,
Bless
but
you.
I have seen patients from other chiropractors that every single week, 2, 3 times a week, and the alignment is not staying. And I want to make a full disclosure of that. If you're getting adjustment and your body is not holding the adjustment, something is missing. That is really important, especially for the neck and the jaw. We wanted to retrain the muscle. Then a lot of patients, when it comes to me and like my adjustments just not holding, we start adding to the program retraining of the muscle. It can be the shoulder blade, it can be the core, it can be all the way down to the foot. But we have to retrain the muscles as much as getting the mobility of things moving. And I think that's really important as a missing component for a lot of people.
I agree with that. And that's how I was taught in chiropractic college as well. You adjust the spine, okay? And yeah, okay, we did a little bit of, extremity work and stuff like that, but not really all that much. But you have to look at the whole component, the muscles. The nervous system is encompassed by the bony structures. The bones don't move on the cell by themselves. The muscles move the bone, and the nervous system makes the muscles activate. So it's really, three
Yes.
pieces here that are all working together. So you have to get the nervous system working good
Yes.
to help the muscles move the bones where they need to be and hold the bones where they need to be. Okay.
Mhm.
So that is the whole structure where we need to look at. Something I wanted to bring up, we were talking about the breathing and so on. Oftentimes people are very tight in their diaphragm. They can't take a deep breath in. Okay. So, and here's the thing to look at. I don't know if I'll give you a chart maybe of the autonomic nervous system that you could put up,
Mhm.
for people, but they can look up autonomic nervous system and you'll see a picture of the spine and organ systems and lines going in between. Those are the nerves going from that vertebrae to this organ, that vertebrae to this organ. Diaphragm is controlled at T8, the eighth thoracic vertebrae. There's a little bit overlap with 7 and 9 in there. But if there is a problem at the T8 vertebrae, the diaphragm might not be working very good. Also, the liver might not be working very good. The spleen might not be working very good. People with gut issues could be L4, L5. It could be the sacrum because that's where those nerves come out, going to those part of the body. People with like a lot of stresses, okay, where do people get with a lot of stress from work and everything like that? They get heartburn, okay, and they usually have pain between the shoulder blades. Well, guess what? T5, the fifth thoracic vertebrae, is right between the shoulder blades, and they get heartburn right there because T5 goes to the stomach.
Yeah.
So their stomach is not handling it either. Emotion is also a big part of this. So that's another aspect. You have to look at lifestyle again. Sometimes people are in jobs as like, you're not going to get better until you get out of that job.
Mm.
It's a hard thing to say, but sometimes it has to be done. And
Yeah.
just get away from the stress and, go on a vacation. That's why we have vacations. A long weekend, go outside, walk in the grass barefoot. Okay. Ground yourself, get out in the fresh air, listen to the birds sing. You have to
Mhm.
get your stress down as well because stress is really one of the big killers. It affects everything. And, it is so hard to say stress is causing this issue, but it does affect everything. Okay.
Yeah, it's a cumulative thing. It's like I love what you say about the everything affects everything. The nervous system, the visceral, the organs, the external stress, and the more we can approach that from a whole,
Mm-hmm.
the better results we're gonna have it. And that's what I see a lot of patients also when they come to do visceral manipulations. One of the techniques that I do, where we work with the organs and many times I see the headache get better. That we
Mhm.
get the organs to feel better, we get the diaphragm to move better, like you were saying. The gut, it has a directly correlation with the brain. That we get the organs to feel better with that specific technique, and then suddenly everything feels better.
Yep.
Then
And yeah,
definitely correlation there.
yeah, the gut is actually referred to as a second brain, and it's also our, almost our primary immune system right there as well.
Mhm.
If you don't have enough hydrochloric acid in your stomach, viruses and bacteria get through, parasites, all kinds of nasty stuff, and they get into our large and small intestine. And that's, the acid in our stomach is really killing a lot of stuff that we need to keep out of our body. Leaky gut issues. Now, we're getting to, pretty deep into nutrition here, but leaky gut is basically you have your gut wall and there's holes in it. And
Mhm.
now suddenly food particles are getting through that into the bloodstream. They're not supposed to be there. And depending on those food particles, it can cause an immune reaction. Okay. Now, also, parts of the cell wall itself from our own cells get through those parts. They get into the bloodstream. They're not supposed to be there either. Now it becomes an autoimmune reaction. You're creating a reaction to particles of your own body. So you have to get your gut healing as well. So you
Mhm.
have to look at the large intestine. Like I said earlier, that could be T3, 4, 5, could be sacrum. And now you also have to look at nutrition. But
Mhm.
it could also be up higher because you don't have the hydrochloric acid to keep all those nasty bugs out of the large intestine in the first place. So you have to look at the stomach. What is going on in there? The parotid glands are so darn important because they put out a lot of saliva, and that starts with pre digesting really of our foods in our mouth already.
Yeah.
What your grandmother used to tell you, chew your food 20
Mhm.
times, it is important. Okay. And it does help. So,
Okay,
it's there's a whole
let's get
bunch of
the
moving parts in there.
it is a complex system. We can't just say black and white, this and this, right? It's a
Yeah.
complex system. And okay, let's kind of move to the food. Let's talk about nutrition. Then can you
Okay.
give us some tips about specifically for headache? Like what are things that people need to watch for with the nutrition? They can kind of like start to change their diets right away. What are the tips you have for nutrition for us?
Well, number one, enough water. Half your body weight in ounces of water is kind of like the rule of thumb. Okay. Um, Depending on how your gut is, there might be certain triggers for that as well. Coffee, actually, for some people, in a way, they're addicted to coffee, and a little bit of coffee can help get rid of a headache sometimes, okay, because it acts as a vasodilator. It opens up the blood vessel, more blood into your brain works better, okay. Now, getting too much coffee can cause, especially caffeinated coffee can cause constriction because it hypes up your sympathetic reaction, okay, sympathetic nervous system.
Balance, yeah.
So then it becomes too much. I have nothing again, everything in moderation. Okay. I have nothing against a cup of coffee. Make it a good cup of coffee. Okay. Also, decaf. I'm not really a big fan for decaf. I know some people can't handle it at all. But if you're going to get decaf, make sure that it is a healthy decaf. Oftentimes, the cheaper brands and so on, I'm not going to name them here, but they use formaldehyde to get the caffeine out of the coffee itself.
Oh,
So
wow.
there is what they call a Swiss decaffeination process.
Mm.
And I'm not exactly sure how it works, but it's a heck of a lot healthier coffee. Okay.
Oh.
Also, make sure that your coffee is mold free
Mm.
because mold can cause problems again in the sinuses, also in the gut, in the lung. So those are the three areas that mold really can affect us. Okay. So looking for that is a big thing. If a person is very stiff, they don't have very much mobility. Okay, that can be a sign of mold toxicity
Mm.
because mold puts off a neurotoxin which gets into the calcium channels of the muscles and doesn't allow the muscles to expand or contract. Okay, so that is kind of like a little gauge there. And that's actually how I measure, do this person really have mold issue or not? is I test them against a product that actually gets neutralizes the mold for a couple of minutes. Okay. And then if they're positive on that, they suddenly have I put the product on them and they have so much more range of motion, they have mold in the system, and we have protocols that can actually help with that. Okay.
Mm.
Measuring mold in the urine is not always valid, but that's a whole different thing.
No topic.
Foods. Let's get back to foods. So coffee. Sugar is a big one that can cause all kinds of issues. I know some people say, "Oh, sugar is doesn't hype up children." Well, I disagree with that one. But it's especially processed sugars. White sugar is the worst kind.
Mm.
Honey is a fantastic sweetener. It's all natural. That's the best kind of sweetener that you can put in your coffee if you want to. Okay. You can bake with it. Okay. Raw cane juice is also a good sugar. Okay.
Mm.
But you want to stay away from processed and ultra processed foods. Those seem to be the worst things for people. Nowadays, also, we spray our foods with chemicals, insecticides and, against the weeds and all kinds of stuff. Well, guess what? We take that in. And a lot of the foods can cause estrogen issues. They're estrogen disruptors.
Mhm.
So that's why we have a lot of young women nowadays. They have big butts and big boobs because they're getting way too much estrogen.
Well,
Okay. So you have to look at the quality of your food. Organic is so darn important. That is what our body is made to work with. We genetically modify it, we spray everything, we nuke our foods, and then we're surprised it doesn't really work for us. Okay. And that we have all kinds of issues, and we're getting sicker as a population because our foods also don't contain the nutrients that we need. Okay. A lot of farms are doing monoculture, harvesting. It's the same thing that they grow on the same land over and over and over again, and it becomes depleted. And they put on a couple of fertilizers. What is it? Potassium,
mhm.
uh, phosphorus, and what's the third one? I can't think
Yeah,
of.
deplete the soil they try to make it up for.
Yes, and
Yeah, that's so true.
and
Totally
it
agree.
doesn't have anything else in it.
Yeah,
And we need the what they call the micronutrients,
the micro.
okay, and
Yeah.
the micro minerals, okay.
Hmm.
For example, arsenic. We need arsenic in our diet because arsenic helps with the immune system. Now, obviously, too much is not good either, but
Hmm.
we need some. And this has been proven in lab studies all over, the world. Actually, they fed a bunch of rats, an arsenic-free diet. Those rats, they died from just a simple exposure to the common cold. Okay,
Mm.
so we need to have everything there, and we need it in balance.
Yeah.
And that's why taking a multi-mineral, a multivitamin is so darn important, and getting your supplements from a whole food source
Yes.
is very important. It's like you can buy a car from a dealership and it's all put together and it drives nicely. Or you can go and buy all the parts yourself, okay, and try and put it together yourself. You might end up with a car, but it might not work as good as the one that comes straight from the factory. Straight from the factory is and there's some companies out there, whole food companies that I like to work with, that they'll take a whole beet, chop it up, take all the water out, and put it in a capsule. That is a whole food because it has all the micronutrients in it, all the cofactors.
Hmm.
Okay, to metabolize sugars, we need chromium. Now, I'm pretty sure that no fertilizer adds chromium to the soil again.
Yeah.
Okay, but we need chromium to digest and metabolize sugars in our body.
Hmm.
Okay,
Dr.
and
Hans, what
natural sugars. Pardon?
is there any specific food that you recommended for people that are experiencing headache specifically? Because I think we can talk about diet all day. There's so
Oh
many
yeah,
good
yeah.
tips that you're
Okay.
talking there. I know we are almost done for the episode, and I want to
Well,
harness a little bit more about the headache. There's some really good tips. I totally agree with you. We need to be very aware of the brand that we're using for supplements, make sure that we're using a whole food. One tip that I always give it to my patient is look at the ingredients. If you can't read it, it's probably
yeah,
not a whole food. It's not plants, right?
yeah.
That's a quick tip for overall supplements. How about
Mhm.
headache? Is anything else you'd like to add for the we can
It
kind of
depends on the individual again. Like someone that is sensitive to gluten, well, okay, you can't have grains. Sorry. And once you've been diagnosed as sensitive to glutens, you can't have glutens ever again. Really, it comes down to that. And now, why do we have glutens? Is because our grains have been sprayed with so many chemicals. The
Mhm.
gluten content has raised up 40 times of what it normally is, and it has damaged our gut irreparably.
Yes. Mm.
That is the problem. So you want to get everything organic as possible. I
Right.
do have patients with Crohn's disease and all sorts of colitis and different things like that, and they can't touch bread over here, but they can go to Europe. And I have one guy, and he'll eat half a baguette and not have really any problems with it. He comes back over here, and our food is not the way it's supposed to be, and he gets all kinds of symptoms. So the quality of our food,
Makes such a
I don't know if there's any one specific thing
Mhm.
because everyone is different.
Yeah.
Okay.
That's good points. Yeah.
It is just, you have to look at the quality of it, the purity of it. Go to farmers markets, get your food, okay?
Mhm.
Or make friends with a farmer,
Yes.
okay, that you know that doesn't spray his stuff. Also for, meat products and chickens, you want free range chickens. We have our own chickens here. Our eggs, I can taste the difference between
Oh,
our eggs and the eggs from the grocery store. The
absolutely.
shells are thicker. The yolk is almost like a burnt orange,
Mm.
that dark. Okay. If you get eggs and like, oh, very nice, bright yellow yolks, it's because they're getting coloring in their foods. Okay. Bugs need to, chickens need to eat bugs, and be outside,
Yeah.
excuse me.
Well, this is fantastic. You guys got so many good tips, and hopefully you guys have been taking all the notes, some really good nutritional advices there. And definitely the source, I think that's such a good important piece there
Mhm.
as well. Then thank you for adding that information. So good. All right, then I would like to know from you, what are the 3 tips that you wish all your patients knew to improve their health?
Okay, well, we've kind of been talking about this. Number one, eat organic, okay, and get your supplements organic. Number two, get your spine aligned because, like what we have said, the nervous system comes out from the spine and goes to the different organs. So if you have compression on there, that organ is not working right, and it's going to have a cumulative effect throughout the whole body. Okay, exercise. It's important to exercise, okay, just to reduce stress. But don't stress out if you miss an exercise program, okay? If, some day is like, oh, I can't go and exercise. Oh my God, what am I going to do? No, that's not good either, okay? Take it, just the next day, try and do whatever some exercise. Walking is, for some people, is enough exercise with maybe a little weight. Little weight training is not bad for people, and most people need it, okay?
Especially after
And like,
40. Have to have.
walking is low impact,
Mhm.
and you're swinging your arms, you're building up your muscles, you're putting stress on the bones, helps against osteoporosis.
Mhm.
So, looking at that, and you're outside, you hear the birds sing, you're in the sunshine. Early morning sunlight is always better, okay? Take deep breaths in, so darn important for everyone.
Oh,
So
so good. We got so many good tips, you guys, to talk about. Definitely talk a lot of good stuff about nutrition. Dr. Hans gives some really good tips on that. We talk about our posture. We talk about the types of headaches and where the locations are. What are some cues that you can kind of like look for when you are feeling something? We talk about so many good stuff today. That was so, so good. Dr. Hans, what is one gift that you want to offer to our listeners today?
Well, one of the things, obviously I love people to come in and, we can get adjusted and, look at the whole body. One of the things that I offer my patients is a metabolic assessment form. Now, this is a form I send them out to different people, and it doesn't look at disease. It looks at your systems, your body systems, and it asks specific questions, and it puts it in groupings like that. So it doesn't really tell you, oh, you have this disease. It means this organ might not be working optimally. Let's look at why it's not working optimally. So that is an assessment that I can, patients contact me, and I can send it out to them, and I'll also do a follow-up 15-minute consult on the phone. Once I get the results back, and it could go through it pretty fast, and kind of make responds that way, and like, oh, you have no problems. And sometimes people are very good and they just have a chiropractic issue, or they stepped in a hole, they sprained their ankle. Okay, we can take care of that. Or sometimes it might be a deeper underlying cause that we need to look at.
Mm.
So, they can, get the metabolic assessment and we'll talk about it then. Yeah.
That's a fantastic gift. Definitely make sure you guys take advantage of that and schedule your session with Dr. Hans. He's fantastic chiropractor. And of course, you guys can hear by now that he has so much more to offer than just chiropractor. He's like definitely has this holistic approach, has tons of experience. That if you're listening to this and you're like have headaches, or if you're having other problems that's associated to headaches, highly encourage you to make your appointment and definitely take advantage of this free gift. This is such a good gift. Thank you for offering that to
No
our
problem. Yeah.
listeners today.
They can get
And
that at my website,
yes,
drvanhuel.com, and they can contact me, and I'll send it out to them, and or I'll email it to them, and they can fill it out and send it back then, and then we'll follow up with a phone call conversation.
fantastic. And I will put your website on our show notes as well. Then if you
Thank
are
you.
watching the show notes, make sure you can go there and click that and you can find his website.
Yep.
And you guys can check out the show notes at www.behealthwithana.com/podcast for all the links and the pictures also that we mentioned today and some for extra resources there. Do you want to say
Okay.
something
And,
else?
yeah, there was just one thing, we talked a lot about headaches, but that's not the only thing. There can be, pain in the hip or pain in the knees and, a lot of inflammation. We can look at those kind of things as well. And they can all be related and they can be totally off, or, separate issues. You know,
Mm-hmm.
I had an instructor that told us, a dog can have both ticks and fleas. You can have more than one problem going on at the same time.
That's very, very true. And again, the holistic approach makes a big difference. I love the way you work is very aligned with the way I work. It's really looking at the body and all the symptoms, how they relate to each other. So, so important.
Yep.
Thank you so much, Dr. Hans, for joining us today and sharing all those wonderful tips.
Well, thank you for having me, and I'm glad to do this, and we'll talk soon again.
Yeah, and thank you so much for the listeners. Hopefully, you enjoyed today's episode. And if you enjoy, make sure you subscribe to our channel, leave us a review, and share our podcast with anyone that you know that needs to improve their health. And if you're watching this on YouTube, hit the notification bell so you can get notified whenever we upload a new video. And if you're ready to reclaim your life and heal from chronic pain, join Be Health Academy. Be Health Academy is a science-based program that offers accountability, pain science education, stress management techniques, ways to shift your mindset, increase your body awareness, and techniques to release the trauma from the body, and so much more. With the right resources, you have the ability to heal yourself, and you don't have to do it alone. Let me show you the way. Join Be Health Academy. And that's it for today. Keep it up with the good work. I will talk to you later. And until then, be healthy.